the thing that I've enjoyed most is this is a type of nursing where you're very privileged in the respect that most of the time you are speaking to people who are well. You're helping manage sort of long-term conditions like diabetes or asthma, and also things like travel immunisations, delivering kind of B12 injections, sexual health screening, lots of different things. But you are seeing them in their day-to-day and helping them manage their health, which is wonderful because firstly, you get to see them as they are as a person, and you get to build relationships up with them long term. So I've only been at the practice that I'm at for 9 weeks, but I have seen people sort of on a returning basis, and that's been really lovely. As an adult nurse, you don't generally get very many opportunities to work with children, but as a GP nurse, you see people right across the life cycle, and you're nursing, you look after whole families. So you are really a kind of focal hub for that family and for the community, and I think that's really special.